Yeah, I think that this really highlights a patient-centered approach at number one, asking our patients when they're in the clinic about what is most important for them. It's very easy for us as clinicians to focus on the things that the community has already defined as important, right? That the physician community and the research community has defined as important. And that guides us toward a lot of the pain related symptoms. And I think it's a good time for us to take a step back and go back to our patients and ask our patients, what is most important to you? And based on this study, and I will say based on my own clinical experience, brain fog, difficulty speaking, difficulty concentrating may be symptoms that our patients report as very bothersome and very important for them to address. And so in the clinic, when I'm seeing these patients and I'm seeing them back after I've initiated a treatment option for them, I should not only ask them about those pain related symptoms, but then focus back on what was most important for them, what was most bothersome to them, and has that improved? So I do feel like this study has highlighted that brain fog is important for patients. The study has also demonstrated that, brain fog, it can be related to multiple different things. It can be somewhat of a vague symptom. However, as defined by the patient, after being on eptinizumab, many patients found some improvement. So again, going back into the clinic, we should be asking patients about what is most bothersome to them. And if it is brain fog, we should ask them how that has potentially improved after treatment. And then for the scientific community, I think this sends a great message that we need to ask more questions about what is brain fog? How can we better define it as a clinical endpoint for future studies? How can we better study this and determine if treatment is improving this from a patient perspective? Because it is important to the patients. So we really should be asking those questions that are most important to the patient in our clinical trials so that when we're then trying to translate that back into our clinic and back to the patient that's sitting in front of me later today, I'm able to tell them about, based on clinical trials, what may improve that's most important to them. I would love to add that, as we all know, migraine is highly prevalent. Migraine is highly disabling. It continues to be a leading cause of disability worldwide. And we are still undertreating our patient population. And in individuals who are having frequent migraine attacks that are highly disabling, we have so many options, and that we really need to focus back on the patient, focus back on what is most bothersome for them, and then determine which options are going to be able to best address what are their concerns.